Good day, guys. Welcome to my channel, Dr. Paramount, a go-to destination for orthopedic insights and practical knowledge skills. I am your tutor, Tokast Agbola. Today, I'll be talking about the stages of bone healing when fracture happens or when a bone is fractured. There has to be some processes the fracture will take, the bone before it heals. So I've comprised everything and I've compressed everything to be three here. So I have 3 stages of bone healing here with me. Number 1 is inflammatory stage. Number 2 is reparative stage. And number 3 is remodeling stage. Number 1, which is the inflammatory stage. So at the inflammatory stage, when fracture happens, when bone breaks, the body will send out signals to some special cells in the body to come to the injured part. So when these special cells come to the injured part, they will become inflamed. That is, there will be redness, it will be swollen, and there will be pain along the fracture site. So this will actually tell the body to stop using that particular place over time so that it can heal. So the other cells that come to the injured part during this area forms hematoma. That is, they clot together. They clot together around the broken bones. So this is what happened at the inflammatory stage. They will send signal to the special cells to come to the fracture site, and they will come to the fracture site and form hematoma. The second stage talks about the reparative stage. This is the stage. This starts about a week. Within about a week after the injury, this will start. And this is the stage where, number 1, the first thing that happened at the reparative stage is that there will be repair, the worn out cells, tissues, they will be repaired. You know, bone is said to be the hardest whitish connective tissue. So for something, for external stimuli, for external thing to affect the bone, which is the strongest, it must have damaged some things along the process. It must have damaged some cells. It must have damaged some vessels. So at the reparative stage, that will start about a week. So the first thing that will happen there is that the worn out cells, the worn out tissue will be repaired. So all those things that has been damaged, that are not bones, they will be repaired firstly. Now the second one is that there will be soft callus formation. The soft callus is the soft callus symbolizes soft bone. So at the site of the fracture, there will be something that will be formed, which is called soft callus. That is a soft bone. This will replace the blood clot that was formed at the inflammatory stage. So this is not a bone that can be used as any other part of the body's bone. So this is a soft bone that is not to be compared with other bones because it's just forming. So the callus will hold the bones together, but it's not strong enough for the body to start using them because they are still coming. They are just growing. There is soft bone that has just grown. So this is the second thing that will happen under the stage 2, which is called the reparative stage. Now, the third thing that will happen under reparative stage is over a few weeks, about 2 to 6 weeks, this soft callus that was formed initially will be replaced by hard callus, which is now strong to be used. So this was the whole scenario that happened under reparative stage. The first thing that will happen is that there will be repairment of the worn out tissues, cells, and all of those things. The second one is that there will be formation of the soft bones, which is soft callus that I've said. And after that, after 2 to 6 weeks, the soft callus will be replaced by the hard callus, which is now strong enough for the body to be used. Now, the last stage which I'm going to be talking about is the remodeling stage. The remodeling stage starts about 6 weeks after injury. At this stage, the regular bones, the normal state of the bone, will now replace the hard callus that was formed under the reparative stage. Now, if you see an X-ray, or if you take a look at an X-ray of a healing bone that is healing, the processing, it will look uneven. That is, it will not balance. It will form in excess. The shape of the hard callus formation will not form to the contour of the limb. You know, let's say for instance we have a long bone. The long bone are very straight. Let's say for instance the fracture happens at the shaft. So if the fracture happens at the shaft and at the reparative stage, when the hard callus forms, it's not going to form based on the shape of the bone. It's going to form in excess. So this is where we have the remodeling stage. The remodeling stage over a few months, maybe 2-3 months, this will now bring back the shape of the bone. So all those the callus that are formed in excess will be trimmed and will be erased. All those things will be erased, and it will now bring back the normal anatomy of that bone. The same way the bone was, so will be restored back under this process, which is remodeling stage. So these are the 3 processes that have come to, that have brought. The first one is the inflammatory, and the second one is the reparative. I told you under reparative we have 3 processes: the repairment of worn out tissues and cells, then formation of soft callus, then it will be replaced by hard callus. Then under remodeling, which is the 3rd stage, the hard callus will be replaced by a regular bone, the normal bone, the way the normal bone should be, and they will be reshaped back to the normal anatomy. Now, very quickly, what are the things that can affect bone healing that may not allow you to heal on time? Number 1, if you have a severe break, if the bone is broken into pieces, or the pattern of fracture is not as simple as it should be. A typical example of it, if you have a transverse fracture now, undisplaced transverse fracture, the fracture tends to heal faster than when we have a displaced transverse fracture. Number 2, if there are damage to the muscles, there are damage to the skins, nerves in the area of the broken bones. So this may tend to increase the process or elongate the process of the healing of the fracture. Also, another reason is why there may be delay in the healing process is when there is vitamin B deficiency. So any patient that has vitamin B deficiency, there will be elongation in the process of fracture healing. Another reason is when there is medical conditions such as osteoporosis, osteogenesis imperfecta, diabetes, or anemia. So when all these are in place in a patient, it tends to elongate the process of healing of fractures. Well, also when the patient takes some type of medicine such as corticosteroids, also drinks alcohol or smokes cigarettes. So when all these are done by patients, the process of healing of the bones will be longer. So that will be all for now. Do well to like, share, and subscribe, because on this channel I only talk about conservative management of fracture, guidance and mentorship. Do well to check the number that will be displayed on screen. Alright, that will be all good for now. Do well to go over the lectures again, and feel free to contact me in case of any question or other things. Alright, thank you. See you in the next class.